Perfect. Okay, welcome. All right, today is June something, 2023. I don't know what day it is. Connected core. We're going to focus on low back, hips, core, pelvic floor, all the things today. Not a lot of upper body stuff, a lot of lower and midsection. So go ahead and find a comfortable position, either laying on your back with your knees bent. If you are near a wall, a couch, a chair, an ottoman, something to put your feet up on, that would be great. If you can do legs up the wall, even better. Okay. So laying flat on your back, booty as close to the wall as possible, legs up, nice and relaxed. Feel that blood flow come back to your belly. And we're actually going to start with a little bit of belly breathing and belly massage. I'm going to stand to show you this, but I want you to do it when you're on your back, legs up the wall. So go ahead and get yourself situated. I'm just going to check and make sure we don't have anybody else joining us live that's trying to get into the room. They're not. Okay, cool. All right. Start taking big breaths in and out through your nose. And while you're doing that, I want you to start using both palms, nice soft pressure or really no pressure, and making nice big circles on your belly. Going, if you're looking down at your belly button, you're going clockwise. Okay. And we're going all the way up to the rib line, this ridge. If I flare my rib cage, I'm going all the way up to that top, down the sides of my belly, across, kind of overlapping the front of my pelvis, my pubic bone, and then up on the right hand side, across right to left, down, across left to right, and up. Breathing in and out through your nose. These circles don't have to stay perfect circles. If you find a spot that needs a little bit more light rubbing, attention, use your fingertips like little foam rollers. Not a lot of deep pressure here. This is fine to do if you are pregnant or postpartum. If you are quite pregnant and you are doing this, if being on your back is not super comfortable, you can do this seated or standing. So we've got any spots that need a little attention, hold there. Take a big belly breath in. A lot of our problems and pain and discomfort that happen and show up in the back are actually because this front is restricted or disconnected. So spending a little bit of time here every day, especially if you have any sort of abdominal scarring from any kind of surgeries, this is super helpful. Okay. So we've taken a moment. Hopefully we're just starting to connect with our body, our breath, where we are right now in the present moment. If you're still kind of struggling, if your brain and mind is distracting or is getting distracted, or you're thinking about other stuff, do a quick 5 senses scan here. Okay. Think about in detail right now where you are. What do you see? The ceiling. What do you hear besides my voice? Maybe the hum of an air conditioner. What do you taste? What do you smell? And then what do you feel? So the what do you feel has some layers to it. Let's just start with what do you feel happening kind of on this periphery outside external layer of your body. So What do your clothes feel like? You feel the floor supporting your back. You feel your legs have this lovely sense of heaviness. If they're up on the wall, you feel maybe whatever sensations have started coming to your body with this little belly rubbing and the belly breathing. And maybe you feel right now the urge to move or stretch or wiggle things out. And if you do, go ahead and do so. Shake the legs, maybe roll the shoulders up and down and back. Whatever feels good. If your legs are up the wall, maybe we need to do some ankle rolls, some calf stretches, a big good morning stretch. Movement, and especially movement coupled with breath work, is a chance for you to have a conversation with your body. It requires, just like any good conversation, it requires you to say things, get it to move. It also requires you to listen and not active listening, right? So not listening for the sake of listening and then responding with an appropriate response. So if your body is telling you, hey, right now, this is really uncomfortable, listen to that, do something different. Or if your body's telling you, this area hurts, all right, let's dig into that and figure out why, that kind of thing. So that's what we're talking about when we're saying you're having a conversation with your body here. Okay, so if you are near, I'm just going to assume from here on out that you are near a wall. You are going to scoot your booty back so that your legs are 90 degrees. Your feet are going to be bent. Sorry, your knees are going to, I always say that. Your knees are bent. Your feet are flat on the wall. So we're coming to like a 90-90 position, like you're sitting in a chair, but your back is against the floor and your feet are pressing into the wall. So booty comes like 6 to 12 inches away from the wall, and then get your feet set up. There you go, Kate. Okay, yep, looks good, Andy. Okay, beautiful. So we're in this chair position. We're gonna just hold this position and warm up our breath a little bit more. I want you to think about, we're breathing in through our nose, okay? You're filling up your pelvis with air. You're filling up your belly with air. You're filling up the sides and your back, okay? So I want you to put one hand on your chest and one hand on your belly, just to make sure that we aren't breathing up top. We want to breathe low and down into our pelvis. Okay, beautiful. So we're going to warm this up with 5 inhales through the nose, filling up all around. But then I actually want you to exhale it out through your mouth, excuse me, and make some sort of a noise. It could be a simple fogging of a mirror, sigh, a hiss, a trill of lips. Make some sort of soft noise with an exhale. You're doing 5, so you're probably on about maybe 4. Breathe in through the nose, out through the mouth. Trying to just move the bottom hand, but that breath is also starting to go into 360 degrees around, as well as down and low into the pelvis, into the pelvic floor. So it's like our breath is water, and it is filling up an empty water bottle. It goes down to the bottom first and then expands up and out. Right? You don't pour water into a water bottle and it fills up top first. It takes intention to do this. This is a function of a lot of different muscles and nerves and movements. So this can be very difficult if we haven't practiced this in a while. Okay, so just keep that in mind. All right. Take your breath work and just kind of set it off to the side a little bit here. I want that not to necessarily be the focus because we're going to be doing a lot of different things. All I want you to think about with breathing is just try to have it be in and out through your nose for this next part. Okay. So with your legs pressing into the wall, now I want you to create a little bit of pressure and you're going to gently push into the wall. We're talking like a 5 to 10% effort push here. Okay. Not enough to scoot you or move you at all, just enough for you to start to feel all of your leg muscles kind of engage and feel a change in the sensation of what's happening, the situation here with your midsection, with your core. Okay, so just enough of a little bit of pressure against the wall. Beautiful. Go ahead and just with the legs, arms can be wherever, relaxed wherever. I want you to press. So we're at like a 5 to 10% pressing into the wall. I want you to press 20%, a little bit more into that left leg and hold it for a second. And then you're going to relax it. And then you're going to press a little bit more into that right leg. And I just want you to notice, you're going to do that about 5 times or so. I want you to just notice what sensations happen or are happening in your legs, in your core. Okay. While you're breathing in and out through your nose, we're pressing a little bit more weight shift into the left leg and then holding it for a second and then a little bit more into the right leg and kind of shifting that back and forth, pressing and feeling what sensations are happening in your core. Beautiful. So we're going to utilize this with our modified dead bug today against the wall. So we're going to add the arms. Legs can relax, and even if they want to stay up on the wall at 90-90, that's fine. If you want to drop them down for a second, you can. Let's review some arm stuff here. So you're going to float your arms up in front of you like a ballerina, like you're holding on to this imaginary physio ball. Okay. Really important here to have your hands just floating right in line with your chest. Okay, they're not up like this, they're not down here. Okay, they are perpendicular to your torso. We've got a soft bend to the elbows and bring your shoulders down away from your ears as much as possible. Shoulder blades down the rib cage. Good. A little bit of an imaginary squeeze here. So an isometric contraction. Squeeze this ball that weighs about 20 pounds. Okay. I want you to feel your biceps and your triceps turn on. So squeeze these muscles right here. This imaginary giant ball that we've got. Okay, cool. So what we're going to do is we're going to create a pressure through the core by pressing our legs into the wall and holding that evenly on each leg while we start to move the arms one at a time away from perpendicular and moving towards parallel. They may only move a few inches, but with a little bit of pressure, pressing down into the wall, go ahead and start to move. We're going to do about 10 of these. The slower, the better. I'm just going to show you standing. I'm pressing into the floor / wall. If you're very pregnant and it is not comfortable or safe for any reason for you to be on your back, you can totally do this standing. I'm in like a quarter squat here, pressing down into the floor, and I am extending one arm at a time, trying to pivot that movement. That movement pivots around my shoulder. So my shoulder's staying exactly where it is here, and my arm is moving around that shoulder joint. I'm not lifting my shoulder up and bringing my arm up towards my ear. Even through its full range of motion, I'm trying to keep my arm as far away, my shoulder as far away from my ear as possible. This doesn't necessarily have to be timed with any sort of breathing, as long as you continue to breathe in and out through your nose, okay? So I'm not super concerned about inhale here, exhale there. Just keep breathing in and out through your nose. The slower you go actually on these movements, the harder it will be in some ways, but the more you will get out of these movements, the more small stability muscles, deep core muscles will get activated the slower we go here. Beautiful. Good. After we've done about 10 or so of those, drop the arms and drop the legs down. Shake everything out. Relax. And do a nice little check-in with your body. So you just did a lot of the talking. You told your body how to breathe. You told it how to move. Now you got to take a moment to listen. What sensations did you stir up in your body? What did it feel about all that movement that you just did? Maybe like me, you've got this little shoulder catch that's trying to talk to you this morning. It says, I need a little bit of extra love today. Okay. All right. Just listen. Don't talk back or judge or say anything, or just observe. What is your body telling you? What did it say after that? Okay. The next part, against the wall, you're going to move. If you're moving your left arm backwards, you're going to push your right leg more into the wall than your left one. So each leg is going to have that baseline 5 to 10% push into the wall. This could be, you could have a couch, you could have a chair, you could have an ottoman. We're not pushing enough to actually push something away from us. Just to create a little bit more feedback sensation into your core, okay? So with that little bit of push, I'm going to push more in my right leg, and I'm going to at the same simultaneously send my left arm back. So instead of traditional dead bugs, we do these off of a wall and we're moving arm and leg away from each other. Instead, the wall's in the way. So it's going to turn into a press, a little bit more pressure into the opposite leg as that arm moves away. Then we come back to the midline and we switch. Press a little bit more into my left leg and my right arm goes back. You should feel this muscle activation happening in a crisscross pattern here. Yeah. Give me about 10 or so of those. Nice and slow. 5 on each side. One side may feel totally different than the other. And again, I am definitely feeling this. You can do this standing. That is an option if you don't have access to a floor, or if you're doing this as a part of a warm-up outside in the park, you don't want to be down on the ground. If you're third trimester and it's just uncomfortable for you to be on your back, we can do these standing. Just breathing in and out through your nose. Not trying to time anything. Good. And of course, when you are done, I want you to drop the arms and drop the legs, shake everything out. Move what needs to be moved. Maybe even a couple big deep reset breaths where you breathe in through your nose, out through your mouth. Make some sort of noise, a sigh. Maybe there's a muscle that is talking to you and needs a little bit of love or attention or extra movement. Good. Okay. We are going to flip it around. You're going to stay on your back. You're going to turn yourself around so that your arms are pressing into the wall behind you. Okay. So this one I will, I'm probably going to drop down on the floor and do it with you guys because I can't stand in my hands. So this one can get a little tricky because of the wrist positioning. It doesn't matter how far away from the wall you are. I would err on the side of being closer to the wall, your head being closer to the wall, the couch, the ottoman, the chair, whatever you can to push. If getting your wrists backwards into that position is a little bit too awkward, you could grab a chair. You can press with fists. I wouldn't do that against a wall, but a soft couch may work. Okay. This is not necessarily about how it looks with the arms pressing. It's more so, again, about with that press, can we create this contraction in the core? Does that make sense? So if you need a demo, I don't know if I can get this right angle. Let me try. Okay, cool. So I don't know, I'm maybe like 4 or 5 inches away from the wall. I am pressing. It doesn't matter. I like to put my fingertips facing down towards the floor. Okay. Yeah. You could also be tented fingertips. So like this position. All right. Head is on the floor, head is relaxed. We're going to get into that tabletop position or that dead bug position again. Okay. Beautiful. But now, instead of pressing our feet into the wall, we are pressing our hands into the wall. And I want you to notice, just when you press those arms into the wall, everybody looks really good. When you press those arms into the wall, notice what happens to your rib cage. And if it's not happening, I want you to actively make it happen. This front part of your ribs, when you press into the wall, should contract and pull down towards your belly button. If it doesn't, I want you to make that happen so that your low back gets a little bit flatter against the ground. Good? Beautiful. All right. So from here, with a little bit of a press, 5 to 10% effort here, we're just going to warm up the arms, just like we did the legs, going back and forth, pressing a little bit more with the right, and then a little bit more with the left. Trying to maintain that pressure that we're creating in the core. So before we start to move the legs here, what's your play around with this deep belly breath? So our breathing is going to be a little bit more important on this one. Gently press into the wall with your arms and then try to fill up that empty can with water and really get it full and really pressurize your core. Create the sensation in your core that you are about to get jumped on by a toddler that is running into the room and saying, "Mom, what are you doing? Why are you not paying attention to me?" Or a dog if you don't have kids. Something is about to jump on your belly and you need to be braced and ready. Okay, that's what we're trying to do here. So play around with that. Now, can you create that braced sensation, ready to get jumped on? Hold it, hold on to it, maybe back it off just a little bit, hold on to it, but still continue to take inhales and exhales. Still continue to breathe. We're not holding our breath through these movements. Okay. So we've got that happening. Then we're going to play around with the legs. One leg at a time is going to drop down towards the ground, only going as far as it will go until you start to feel your low back arch and pop up, your ribs pop up, your hip restrict you. We're going to do about 10 of these. The slower you go, the better. I'm moving really fast. Pressing both arms into the wall behind you to give you some support. As you slowly lower those legs down. I'm checking on everybody. Kate looks good. Janika looks great. Awesome. When you've done your 10 or so, my numbers that I give you are always just a suggestion. If you get to 6 and you're like, "Whoa, I'm done. I have felt what I needed to feel," that is fine. If you want more, you can do more. The numbers are just suggestions. Okay. If we're done there, drop things down to a resting position. Take a couple of breaths just to listen. Okay. We are going to bring that back up and focus on the crisscross. Okay. So as your leg lowers, but really before your leg lowers to the ground, press more weight into the opposite hand. So I'm really going to press into the wall with my right arm, and then my left leg is going to go down. Now, if you want a little bit more feedback, while your right arm is pressing into the wall, your left hand could come onto your belly to make sure, to give you a little bit of tactile feedback, to make sure that your ribs are pulling down towards your belly button and that everything is staying nice and compressed. And we can stay here and do all 5 of our leg lowers. In a row on that side. if you want, just to mix it up. This is great. This other hand is great to have on your core to check in, make sure that you're not coning, separating, rib flaring, back arching, all the things. It's a great information tool for your brain, just to give it a little bit more sensation. Okay. And then we can switch. We're going to do 5 on the other side. So I'm going to press my left hand into the wall. My right hand is on my belly, making sure that I am tucking my ribs down in line with my pelvis. And then I'm going to do 5 lowers of the right leg. And that side is much easier for me. If you find an asymmetry, and you want to work a little bit more on that weaker side, I would say weaker side, the side that is not as connected. This shouldn't be causing any back pain. If you're feeling this at all in your low back, focus on where your breath is going and make sure that you're breathing into still 360 degrees around your belly or your low back, but also underneath into your pelvic floor. Managing where your breath is going can help those low back muscles. Really good. We're just gonna wrap up. We got a little over 5 minutes left. So we're going to stick with this theme of wall dogs and wall birds. Okay. And slowly start to come off your back, roll to your side, press yourself up. We're gonna go on to all fours. So that was a couple different ways to modify our dead bugs. A classic staple for birth fit, a classic staple for really any core rehab or low back rehab program, a dead bug. A bird dog is very similar. It is flipped upside down or right side up. It is all fours, but it is the same principle and the same essentially movements. The principle of deep belly breaths, shoulders away from your ears. I'm in a tabletop. I'm in all fours. I'm going to keep this soft bend to the elbow so my shoulders can stay away from my ears instead of sneaking up like this. Okay. I am close to the wall, and actually what I'm going to do is I have tucked my toes so that the ball of my foot is kind of pushing into the wall behind me. This isn't going to be a perfect full foot push into the wall because that would require your foot to come off of the ground. Your toes are touching the ground. They are bent. I'm kind of pressing into the wall with the ball of my foot. We only need to create a hint of pressure here, pushing into the wall. So it's not like we're pushing on the ground. Does that make sense? Just enough for you to feel a little bit of extra push. And what can actually really help you recreate that same sensation we did on our back is push your booty back towards the wall just a little bit. Almost like you're trying to squat down to push yourself away from the wall. Does that make sense? If you can't find that, you can play around with kind of rocking your hips back and forth. We're just trying to use the wall behind you. I'm pressing in really with just the ball of my foot. A little bit of extra pressure here. If you, when you're practicing these at home, if you happen to have a physio ball, or a big couch cushion will work too. You don't have to do this right now, but I'll just show you for future reference. If you happen to have this between your butt and the wall, I'm back onto my all fours. I've got something to push into the wall. Does that make sense? Okay. So I want you to recreate that sensation that you've got this ball behind your butt. My toes, my balls of my feet, kind of my toes are up on the wall. And then I'm pushing this ball back. So whatever you got to do to create this sensation in your core here that we're pressing behind us. Cool. All right, let's dive into this because I want to hit both positions here. So hold on to this extra pressure in our core that we've created, and then dump all of your weight into your left hand so that your right hand can just float away from you, and then bring it back. Push all of your weight and your pressure into your right hand so your left arm can float up. Do that about 4 more times on each. You don't have to have a ball. It does make it a little bit easier to have a little tactile sensation. If you got your toes tucked in your ball of your feet on the wall, you could also do big toes on the wall behind you. That may tweaking the feet position may help you create a little bit more of this sensation. Putting all that pressure down into the left arm, the right arm floats away. Don't forget to breathe. Good. Ten or so of those. And then just like we did both directions with our dead bugs, we can do both directions with our bird dogs. These are a little bit more tricky. These have kind of gone up in difficulty as we've gone through this. So if I'm here, you're going to take one arm at a time. This is important. One arm at a time here. Let me see if I can change my camera angle. We'll revisit these next class. One arm at a time is going to press into the wall. I'm pressing my left palm into the wall. I'm pressing my right palm into the floor. And I'm going to extend my right leg. Pressing into the wall with my left, reaching behind me with my right leg. Back down to the middle. Taking my right hand and I'm pressing it into the wall. I'm pressing my left hand into the floor and I'm extending my left leg behind me. One more time each side. Press, press. That's it. Press, press. Extend. Beautiful. Lots of different ways to keep your dead bug and bird dog practice not boring. Lots of different options. Or if there's ever a time or a day, which is very common, for you to be doing traditional dead bugs and bird dogs, and you just can't quite feel it, grab a wall or something to push against. See, there's the dog. Jump on mom because you're on the floor, right? And the toddlers. Wonderful. I'm going to stop this recording. If you have any questions, please let me know. You did great. So that was kind of our wall assisted dead bugs and bird dogs.